All right, so next we're gonna go through Part B of Medicare. So let's get rid of A in hospital. So Part B is your doctors, your labs, exams, tests, procedures, ambulance, emergency room, essentially anything that's not room and board in a facility or a medicine you get at a pharmacy. So Part B, the cost for it for most people is $185 a month. That's in 2025. It does go up every year. So if you're watching this in the future, it's gone up. That's the cost for most people. If you have a lower income and you qualify for your state's Medicaid, you can very possibly get the state to pay it for you. It's very important you pick the right plan to make sure those costs are covered the best way for you. As far as the actual costs internally for Part B, it's an 80-20. Medicare pays 80%, you pay 20%. But that's after Medicare negotiates the rate. So you've probably gotten a bill in before and it's thousands of dollars or tens of thousands or $100,000 for a big surgery. By the time insurance is done negotiating it, it's way down. Medicare does the same thing. So your 80-20 is based off that reduced down negotiated rate. So I know I've talked about not having a cap there and the high cost of hospitalization. What we're gonna do now is we're gonna go over how a Medicare Advantage plan or a Medicare supplement plan cover those extra costs after we go through Part D drug plans. At 65, they went there, the VA said, you don't need to do anything, just use the VA, you're good. At 75, 10 years later, they both came to me and were unhappy with their care. So every year you go without credible coverage, you have a 10% extra penalty.